Assessing the type of isolation needed, standard, air bonds, droplets or contact. Then I'll go ahead and get the collections for it. I'll get the isolation ground, and I'll get gloves, but we do not have gloves today. And I'll go ahead and get a mask, and then a face weight if you need it. And then I'll go ahead and put this in, okay? I'll go ahead and move any jewelry that I have at car wash, so I'll take this off, but for this video, this won't come off. And then I'll roll up my sleeves, if I have long sleeves, and then I'll go ahead and apply on the surgical gown, which is this way. Okay. So I'll go ahead and put it on, and then once I got it on, I'll have to tie this two up. I'll tie this up, and I'll go ahead and tie these two up. Then once I'm ready, I'll go ahead. Oh, and if I put on gloves, while I have this on, I have to make sure that it covers at least this much of the surgical gown. And then I'll go ahead and do the quality of life, and I'm gonna pretend that Judy is gonna be my patient for today. So I'm gonna go ahead and knock in her room. Hi Judy, my name is Chantal, and I'm going to be a student nurse for today. I'm going to go ahead and protect your eyes during the procedure. I'm going to handle you gently, and I'll protect your privacy. And then now I'm going to go ahead and protect your privacy, and then I'll explain what we're going to be doing for today, isolation. So pretty much I'm gonna be doing isolation with preventing transmission, and I'll be protecting you from any illness from anybody, any patient. So then I'll ask your family if they have any questions that I can explain to them before I begin. And then now I'm gonna go ahead and practice my hand hygiene. And then once I'm done, I'm gonna go ahead and ask Judy if I can see her wristband. Can I see a wristband? And I'll look at it, and can you identify your name and the birthday for me?
Judy Kinter, 0401-2000.
All right, and then I'll have to check my care plan to make sure that it's right, and it is right. At this point, I'm gonna go ahead and ask my patient, give my patient like a TV or an activity to be doing to keep them busy while we're doing everything we're doing. And then I'll go ahead and keep the room clean. And then I'll open the blinds for the patient. And then I'll move anything that is on her way. Okay, so now I'm gonna go ahead and turn the TV on for my patient, and then I'm gonna ask my patient if there is anything else I can give her to keep her busy while we keep on going the procedure. And then now I'm gonna go ahead and check for the room if there's anything on the way. I'm checking it, and if it is not, so at this point I'm gonna take a paper towel, and then I will use the paper towel to open my door, so I don't have to touch it with my gloves on. So I'll go ahead and open the door, and then once I got the taken care of, I'll go ahead and remove I'll go ahead and take off my gloves first. Take them out, and then I'll use these two fingers to just go in between and then take the glove off and do the same way to the other end. And now I'm gonna go ahead and remove my surgical gown. Then I'll take it off like this, and then I'll go ahead and untie the back here too. Okay, I'm just untying it. Okay, so once I got it, I'll go ahead and take it off, making sure that it don't touch any of my clothes. And then And when I take it off, I have to make sure that it's kind of folding in this direction, so I don't have to export anything to anybody or myself. And then I go ahead and throw this away. And at this point, I can go ahead and remove my eyewear if needed or is needed, and I'll take off my mask, but I'm not gonna take it off today because the COVID. And then I'm gonna go ahead and give my patient a call right in the reach if my patient needs anything, so my patient can reach me. I'm gonna go ahead and come from my patient, ask my patient if she needs anything, blanket, or anything else. And then I'm gonna go ahead and make sure the room is safe, safety for the room. And now I'm done. I'm gonna go ahead and document my observation.